The information contained in this episode is for informational purposes only. No material is intended to be a substitute for professional medical advice, diagnosis, or treatment.
We need a revolution. There's only one solution. I need somebody to show me love. We need a revolution.
Hello and welcome to episode 368 of Informed Life Radio on 1150 AM KKNW and streaming to CHD TV, Rumble, YouTube, and Facebook. Thank you for spending your valuable time with us today. I'm your host, Lisa Templeton, and if you appreciate conversations like these that we don't hear in corporate media, please consider supporting the nonprofit that keeps this program on the air. Visit informedchoicewa.org and click donate to make a one-time or recurring gift. Thank you. And to keep in touch with us and receive our cost-free weekly public health watchdog reports from Washington, subscribe to informedchoicewa.substack.com. The views on this show are not necessarily those of KKNW or CHD, and the information provided is not intended to be medical or legal advice. And before I bring on our guest, I have good news and bad news about the upcoming world premiere of Duty to Disobey for one night only on June 30th. You probably know already this is a film from CHD and Tommy Burrows Productions that reveals the injustice experienced by U.S. service members who refused the COVID shot and why their story is important to every American. Well, I'll start with the bad news. 2 of the Washington theaters where we planned to screen the movie did not receive enough reservations by yesterday, so the show won't go on there. And that's Tacoma and Kennewick. People who bought tickets there will receive a refund. But the good news is that the show will go on in Seattle, Federal Way, Vancouver, Burlington, and Spokane. So if you haven't already grabbed your seats and got us to the threshold, well, if you did, thank you for that, making sure the show would go on. But if you haven't reserved yet, please do so at dutytodisobeyfilm.com. And you can also watch the trailer there and even sign up to watch it at home, get a preview before everybody else, not just a preview, but the whole film on June 9th. And maybe you can even host a house party. Well, I'd like to bring on my guest now. Charles Frohman is a Virginia-based health freedom advocate, writer, weekly Freedom Hub podcast host, and lobbyist for the National Health Federation, the world's oldest health freedom organization. I got to meet him recently at their conference in Dallas. And he's also going to be speaking at Joel Salatin's 2 Days of Truth next month at Polyface Farms, which should be a real treat. Hopefully, look into that. Maybe you can go. And Charles's recent efforts center on wireless radiation and cell tower policy, especially preserving local control so communities and property owners can challenge tower placements near homes, schools, farms, and places where children gather. So welcome, Charles. Thanks for joining us.
Thank you, Lisa. I'm glad we arranged this when I met you at our Dallas conference.
Yes, and the way I immediately spotted you and came over and introduced myself to you was my friends Roman and Bodana Shapoval. I told them I was going to the conference, and they said, you got to find Charles and say hi to him for us. So I understand you guys go back a little ways anyway.
Yeah, Roman is part of that class of experts on how to mitigate the wireless radiation mesh that basically has become inescapable. And that's how this issue differs from vaccines, because with the religious exemption, at least, in almost all states, you can avoid those Franken shots, but you really can't avoid the radiation now from the ubiquitous towers. And so Roman is one of those experts that can tell you how to mitigate your exposure. You know, things you can do around your house and your daily lives to keep yourself safe. or what to do once you get sick. And a third of us are sick already, which is insane. I had no idea the damage was that widespread already. And people don't even know anything about this.
Right. Yeah, we've had Roman and Bodana on a few times now, including a few weeks ago with some really great practical, actionable tips. You kind of alluded to something I was going to ask you in a couple questions, and that is how is wireless? You were recently on a CHD TV broadcast giving a warning to the public, and you pointed out about what vaccines and wireless radiation have in common. Do you want to share those 3 points real fast? I'm sure they'll be quite familiar to our audience.
Yeah. I often tell Republicans who are kind of bad on the wireless issue, and they don't know they're bad until they learn that the dynamic with wireless is, as you are suggesting, the same as with vaccines. There's no informed consent. There's corruption of the science and capture of the regulatory process. Like I said already, you can't really avoid the wireless radiation, so there's no informed consent. You can try to push these towers away, but it's really hard. So you can push away vaccines with exemptions, but it's harder to do so with the antennas. The science is as corrupt as vaccines. 8 out of 10 studies show harm from wireless if the study is not funded by industry. Just as with vaccines, we know the science is on our side, even though no one knows about it. So it's the same dynamic, and telecom has captured the FCC just as pharma has captured the FDA. Same dynamic.
Yep, same old playbook, isn't it? You work in many health freedom areas, but today we're focusing on cell towers, wireless radiation, and local control. Why has this become such a central issue for you and the National Health Federation?
It was kind of by accident. So when I got hired before the pandemic, I was well positioned to help mainly Republican congressional staffers deal with what we all knew was a coming vaccine and a coming vaccine mandate after the nonsense about the virus, whatever it really was.
Mm-hmm.
And so, I got some pretty good success during COVID, but before CHD hired a lobbyist, I was the only one up there. Now, it's not that there weren't heroic congressmen like Ron Johnson working directly with frontline doctors to do the Great Barrington Declaration, have those great hearings. But there really was no one walking the halls of Congress, or in my case, Zooming with congressional staffers, because they didn't really want us around. When the Del Bigtrees were at the ACIP meetings, combating this inexorable expansion of the FDA clot shot authorization to ever younger cohorts on down to toddlers, I noticed that no congressmen were raising a voice. It was just the Del Bigtrees, smart people fighting pharma puppets at FDA or CDC, at ACIP and VRBPAC, the advisory committees that lead to the mandates. Mm-hmm. So I got a few congressmen to co-author a letter to the FDA not to authorize the clot shot for toddlers. Of course, we failed, but that wasn't my goal. I knew we weren't going to win. My goal was to get congressmen off their butts, to establish sort of a core group of Health Freedom Caucus, mainly type politicians, who would stop being quiet about this. And then we did a second letter, and my vaccine attorney for NHF wrote a bunch of great questions that FDA could not answer. The questions were so profound that Robert Malone Substacked about them, saying, wow, what a list of questions. Answer these, FDA. And those efforts were covered by a couple of right-wing media outfits, Daily Caller, which was founded by Tucker Carlson long ago, and Epoch Times.
Okay.
And then I got another letter to Biden to lift the ban on immigrants or just visitors to the U.S. who aren't vaccinated. And my goal there was to exploit the controversy over keeping Novak Djokovic out of the U.S. Open. he couldn't play here because he wasn't vaccinated. You can't be an unvaxxed visitor during the pandemic. So a friend of mine from long ago was starting to lobby against the cell towers. And I knew that NHF, like CHD, had done stuff on wireless radiation. Most health freedom activists didn't know too much about wireless radiation. They were properly focused in the state legislatures protecting the religious vaccine exemptions, which are always under attack by mainly Democrats. And so, knowing this other person in the wireless space, I got sort of drafted into it to be sort of their lobbyist. And over the past 3 or 4 years, we have scheduled meetings almost every week with congressional staffers to educate them about the wireless issue. And it's been a big learning process. And folks, it takes effort to learn wireless, just like it took us effort to learn vaccines. You know, there's no shortcuts.
Yes.
But once I
think that's
saw,
one reason that's. Sorry, I think that's one reason that so many more people haven't gotten involved, because well, for me at least, it seems a lot harder to understand all the wireless, all the units and all that.
well, I tried to avoid learning the details of frequencies, high band, low band, and just defer to the experts who already know the stuff, like Frohman. What I talk to with grassroots folks is just the basics to keep it simple. And once I learned, like I said earlier, that the dynamic of the assault was the same between wireless and vaccines, I realized I had a hook that could get Republicans to care, and it worked.
Oh, okay.
It worked in part with the help of CHD, not just NHF and the National Call for Safe Technology. But we did get a few Republicans finally to oppose preemption. So this horrible bill that almost passed the House did not. So
Okay, Charles,
we have a stalemate right now.
Okay, what is preemption, and what is this bill you're referring to?
Well, if you like, I can show a couple slides
Okay,
that
sure.
could make it visually easy
Okay, and
to.
remember to explain for our audio-only listeners.
Yes, I will.
Thank you.
Indeed. And I think I did the entire screen last time. And let's go and confirm for me, if you will, if you're seeing the slides. Lisa?
Yes. Okay, I do see a picture. Is that you?
Yep, that's me from Dallas. And this first slide just gives an overview of who we are. People don't know who our group is, National Health Federation. We're the original MAHA people from 1955.
So impressive.
We're mainly busy at this thing called Codex, trying to keep the food free of contaminants and residues as it gets traded internationally. We helped pass this DSHEA law, which helps your access to nutritional supplements, and we helped naturopaths and adjacent healers over the decades going back to the 1950s. My hiring made us really involved with vaccines, as I just explained how, with the FDA clot shot for toddlers. And then we have gotten involved with the rogue telecom situation with wireless, and that creeps over into the farm and ag area, agriculture. But one thing you didn't mention in your intro is that I'm also a health insurance salesman, and I've
Yes.
been very involved since my days on Capitol Hill in the early 1990s, empowering consumers with cash patient making plans. So one thing that, unlike other MAHA people, I know a bit more than those MAHA folks about supply and demand of healthcare when it comes to health payment, and how to create better healers around the issue of licensing. So I'd love to discuss that at some point, not now, but just to give you an overview. That's who we are. We cover all the MAHA issues plus sort of health supply and demand issues, which we don't have to go over now. But in that slide that you're welcome to share with people afterwards is our submission to Kennedy, RFK, at the MAHA thing at HHS. It was co-signed by Mary Holland at CHD, Peter McCullough, famous frontline doctor, Meryl Nash, frontline doctor, Simone Gold, frontline doctor, Tom Renz, the heroic lawyer, over a dozen other organizations and experts.
And
But here's
what letter is it that they signed?
it was NHF submission to MAHA. What should MAHA focus on?
Okay.
You can imagine what it is. Vaccines, wireless, geoengineering, etc.
Okay.
But so I have four images here for the listening audience. And so when talking about wireless, the first thing you need to know is that you've been ripped off. Everyone with a landline, a phone, over the past decade has paid what's called a surcharge on that bill to pay for your phone. And hundreds of billions of dollars were raised by that surcharge imposed on you. And you were given a promise in exchange for that surcharge of a wired connection to your home for internet. That money was stolen by telecom and diverted to their wireless schemes. So you should be angry. And there's a court case that it has given the green light to state attorneys general to audit what happened to that money. So the first thing you should know is that if you're being pressured by Verizon, T-Mobile, AT&T to give up your fiber or cable in exchange for what's called fixed wireless or satellite, I can understand why you'd be tempted around cost and convenience, but just know the context. You've already paid for a wired connection, number one, okay? So you've been ripped off. Start off with that. Number two, these telecom cronies are lying to you that wireless is safe and cheaper when it comes to taxpayer funding. There's a lot of taxpayer money used to dig these ditches for fiber to those of you who live in the rural areas and remote areas. And they don't want to dig those ditches or hang those fiber or cable lines from existing telephone poles to get it to you. They say it's too expensive. That's a lie. The economists at the Benton Group, which is a pro-wireless group, have done the math. And after 3 decades, any savings from replacing your wireline with a wireless antenna is lost. So there's a savings in the short run, but not the long run. So don't let them lie to you, which they're doing to Congress. They're using a phrase called technology neutrality. And let's be neutral on where taxpayer dollars go between fiber and wireless. And they're lying. The economics is not with them. It is a better deal for taxpayers, even for the remote household, to dig a ditch and put a fiber to what's called the last mile to your home. And you want fiber or cable because it's faster, more reliable, more secure, and cheaper in the long run. Number three, you and I already discussed this. You've had Frohman on. Up to a third of us already are injured by wireless radiation, and you don't feel it because it's what's called biological. It's not thermal. Thermal means heating of the skin. Oh, it's hot. I feel it. Or sometimes you put the phone by your ear. Oh, your ear's starting to get warm. That's a thermal effect. Cynically, only thermal heating is accepted by the government as a signal of danger. But that's not how wireless harms you. Wireless harms you without you feeling it. It agitates your DNA. And that's what the National Toxicology Program found in a $30 million study arranged by the FDA. And industry knows this from whistleblower testimony. We have documents. They know the risk is biological. It agitates your DNA at the very core of your being, making you susceptible to disease. So that's why RFK says it synergizes with other environmental injuries to harm you. The good news is the fourth image on this slide. RFK, as with vaccines, is our hero on wireless. He is studying the danger of wireless. Not that we need more studies, but politically, in reality, we need more studies because, as with vaccines, they're suppressing the science. So good news is Republicans are slow to help us, but RFK is educating them. But I need your help to schedule meetings with your politicians so that we can educate more staffers because they don't know squat about this issue. just like anybody else. And my last slide here, I just sort of give the timeline on the issue with links, so you can read about it and get involved. Basically, the first couple points there, we're losing. We lost in the last Congress. All your beautiful national parks are going to be buried with antennas. Existing cell towers are going to have a lot more new antennas, and farms are next. So that's where the current lobbying is happening, and the farmers are being lied to. They're being told that what's called precision agriculture will lower their input costs on pesticide use. That may be true, but what they're ignoring is the science on the bad effect of wireless on what's called yield. And farmers care about that word, yield. There have been court cases closing down towers for depressing milk yield, the supply of milk from the cows, by 20%. A fifth of your milk gone because of a nearby 4G cell tower. So that's what we're trying to do. We're trying to educate farmers that any savings from lower inputs like pesticides, from remotely monitoring your crops, or remotely moving your cattle with a laptop, a GPS, a receiver, a tag on your cow, or a private wireless network, there is a cost to that convenience in terms of the same DNA agitation of the livestock as happens with humans. And similar science shows bad effects on the soil biome and the crops and the pollinators. So the farmers are being tricked into precision agriculture, and we need your help to educate them, because one of the provisions in the Farm Bill, and this link on the slide will go to it if you want to read about it, would encourage farm use of satellites. And satellites spray everywhere, so no informed consent as you get sprayed by the radiation from satellites as they facilitate communication. And there's no environmental analysis of the amount of radiation or power coming from satellites. The GAO has said that's a problem. We should know what the health harms are. We don't have any knowledge of that. So it's shoot first and ask questions later when it comes to industry and telecom. And my next slide goes about the lying that I talked about earlier, how telecom is lying to people in underserved, remote, rural areas to get the wireless out there. And no one is assuring safety. I mentioned the toxicology finding of a clear evidence of cancer that the FDA ignored. The EPA has found that the harm is biological. Further studies at EPA were defunded. The FCC has claimed that it's got everything handled, don't worry, but its exposure limits were thrown out by the DC Circuit. So we are flying blind. It's deploying now, like vaccines. Vaccines are studied after the fact. You report injuries to the VAERS database, and then the government is supposed to look for signals of injury and study them. Now we all know the FDA doesn't do that, and no one is looking at wireless radiation danger. And these towers are coming closer and closer to your bedroom, your kids' classrooms. There's cancer clusters around schools now, Ripon, California, in Missouri and other schools, teachers and kids getting cancer. Tower gets removed, the cancer cluster goes away.
Wow. Hey, I have a couple of questions to ask you, backing up a little bit. You said people can schedule meetings with their policymakers and you can help somehow. How does that work?
Well, one of the takeaways from today's discussion is that it may seem a bit complicated. So, we've done a great job with vaccines. A decade of state legislature defense of the religious exemption has made a lot of us smart on vaccines. And no one wants to go through the drudgery of learning a new issue. All we need is help scheduling Zooms with your U.S. rep, telecom staffer, and we have a formula of how you can do that. And then don't worry, I'll do the talking along with my lawyer colleague, Odette Wilkins, from the National Call for Safe Technology. CHD has its people helping us get these meetings scheduled. And since Odette and I have done the talking for 3 years, most groups are just satisfied with letting us handle it. Because, again, we know, most of us know vaccines, we don't know wireless. I've had to learn it.
How do people engage you in that manner?
So twice a month at thenationalcall.org, just click the Join Us tab and sign up. You'll get emailed an invitation for our semi-monthly Zooms where we have experts present. So we learn the issue twice a month, and then we'll just coach you on how to get a meeting scheduled. So thenationalcall.org.
Okay.
I'll put it in chat. So you can look at it there.
And then when you mentioned that farmers are being told that their input requirements will be decreased for wireless, due to wireless, that would be because they can remotely monitor their crops and let cattle into a different paddock?
Yeah. So precision agriculture is a big part of the future of modern farming. And so a farmer will buy a drone, put radio frequency identification tags on the ears of their cows, and have a laptop, GPS, and a private wireless network, which we're okay with. If you want to purchase a wireless network that's private and just emanates radiation on your farm, you're not assaulting your neighbor with radiation too much. Even though you and I know the routers in our neighbor's house sends radiation to our house. So we would like them to turn it off at night at least. But they want to remotely monitor their crops. They want to remotely move their livestock. And by monitoring their crops, they can better judge the need for pesticides that they are going to use for a long time. And that'll save them money. And so what they're not really thinking about are some of the costs to that convenience. Namely, we have court cases where nearby 4G towers have been blamed for culling 20% of one farmer's cows, the same percentage depletion of milk yield. Another farmer complained of blinding among calves. A congressional staffer has complained about self-harming among cows in dairy country of Wisconsin. This stuff is expensive. Wireless equipment has a 5-year lifespan, so that's going to create a variable cost. Any additional cost on a tightly margined farmer is going to necessarily bankrupt a certain percentage of farmers. And that's going to lead to more purchase of American farmland by Bill Gates and his friends at the World Economic Forum. And a lot of us, and some Congress people, are concerned about the percentage of farm being purchased by these globalists or even Chinese communists. So there is legislation to put a stop to that to a certain extent. But it's also insecure. 5G, especially the 5th generation of wireless, is software-based, and therefore, unlike previous generations of wireless, it is very hackable. And once you get access to one node of the software, you can hack the whole system. There have been stories of casinos being hacked because of 5G through a monitoring device on a fish tank. They accessed the wireless monitoring on a fish tank and got access to all the donor, the gambler data. And that was very bad for that casino.
Wow. So
if our farmers are hacked by adversaries, that could put at risk our domestic food supply. So there are a lot of risks that we're trying to educate farmers about. And it's not easy. And, it's not easy to get every health freedom person to care about the farmers, but the satellites they're going to rely on will spray everyone in the rural area, not just the farmers. And there remain the other bills like preemption that deal with towers closer to your house. And I just testified in Washington State for a colleague of mine against a cell tower application near her bed and breakfast. And people need to know this. They lost, even though we proved our case. Telecom needs to show that there is a gap in service, that you're dropping cell phone calls. Oh, we need another cell tower. My calls are dropping. No one claimed that. The residents testified, no, we're not having calls dropped. You haven't backed up your claim that there is a gap in service. Therefore, we don't think you should have a cell tower there, which, by the way, is hurting our home value. So property owners need to know that their county officials aren't making telecom back up their claims of a gap in service needed to justify a cell tower. These cell towers are going to kill your property value by 10 to 20%, according to studies, especially if your property, you can see a cell tower. Polls show 9 out of 10 buyers refuse realtor offers of homes too close to a cell tower. And then there's the health effects. A third of us are already sensitive to wireless radiation, up to 5% seriously so. But you can't oppose a cell tower based on health effects, which is an insane part of the law that goes back a ways. So the preemption I'm talking about is on top of preemption that already has occurred in the past. So we're really behind the 8 ball on this issue. Hence how vociferous we are about educating our fellow vaccine friends to please help us get meetings with members of Congress to educate them, because we do need to restore local discretion. We don't want preemption. We want decisions locally. So there's a bill to do that. CHD has a related bill to repeal this preemption section I mentioned that bars environmental complaints to stop a cell tower. And what you have to realize is environmental complaints includes humans. When Republicans realize environmental effects includes human health effects, they're not so knee-jerk against environmental review, which I was too. I was a Republican congressional staffer long ago, and we all learned. But those 2 bills, and there are other things we can do through the appropriations process. I mentioned, the loss we had in the parks, our forests. We could try to withhold funding from implementing that new law to plant all these towers in our forests and national parks. That's the current law we lost. So what you can do is try to withhold funding from implementing that horrible section. And there's things you can do on the state level. You want to opt out of your smart meter for gas, electricity, and water. That's not easy to do in every state, but you need to get that law right in each state. States bar community broadband, like in Utah. You have some in Washington State, but you want local governments to be able to erect their own fiber networks that they can expand to surrounding rural areas. And as a libertarian myself, I'm not a big fan of government operated operations, but I'm also, aware as a libertarian of the extent to which corporations capture the government and screw us over. So that's what they have been doing big time with telecom. They will dig ditches for fiber and leave it in a state that's called dark fiber. We have hundreds of miles of fiber around the country that's dark, not used. So
the fiber has been laid, but it's not utilized?
It's insane. They don't want the fiber to the last mile because they won't make as much money as if compared to if they hook you onto a wireless subscription. They want to monetize your data with the Internet of Things sensors in your appliances and TV, thermostat, and smart meter, so that the governments later can control your behavior with a social credit score. and digital
So
currency.
when you say it's not as profitable for them to have fiber, it's more profitable for them to have wireless, that's because of the monetization of the data. Is that right?
Yeah, and plus also the upkeep of the equipment if they can charge the government or local governments or you. So, and also obsolescence, which is a term in technology where you see my phone here. I don't know why I've had to upgrade so often. Obsolescence is the purposeful retirement of older models to
Yeah.
force you to fork over some dough to upgrade when you
Okay.
otherwise wouldn't have to.
Okay.
I want to keep
Now,
my old phone as long as possible. So yeah, they're
right.
going to use obsolescence to force you to upgrade. That's expensive. They need to upgrade the equipment. They want to monetize your data. That's the big one
Mhm.
with the Internet of Things. And the governments and the globalists, they want to coerce your behavior with a social credit score. And you need the wireless mesh to do that.
Backing up a little bit to the term preemption that you used, that is that some federal law preempts local control of wireless policy.
Exactly.
Okay.
So preemption of local discretion on where antennas get located has been the law for decades. So many different preemptions have been put in place. You can't stop 5G small cell towers from being deployed in what are called rights of way or public parks. Um, you can't. Local governments have a time limit of a month or two to make their decision on an application from Verizon for a cell tower. You can't stop new antennas from being mounted onto existing towers. You can't use environmental effects as a reason to stop a tower. Those are preemptions that already exist. So when I talk about stopping preemption now, it's just worse. So no limits on additional antennas on any structure or any structure that can support a tower. You can't stop with local zoning and just more severe time limits. So the preemption bill is just an industry wish list to really neuter the ability of your local official to help you as a property owner. If you wake up one morning and see a tower a mile away, that's going to ruin your property value as well as your health. Most folks don't know about the health risk, but a lot of folks know about the property value threat. But if the preemption bill HR 2289 passes in Congress or is passed by the FCC, is docket number 25-276, or provisions of that are shrunk, maybe some smaller versions of it are snuck into a must-pass bill, like a big beautiful bill. That's how they do it at the end of the Congress. We'll just get less discretion than we already have. Our hands are already tied, so we're trying to restore that. There's a bill from a congressman in New Jersey, Chris Smith, that would repeal one of those preemptions I mentioned, and then CHD has another repeal of preemption around Section 704 that would allow the use of complaints of health effects to stop a cell tower.
Okay.
And then so
So this is
but the basic
Yeah.
thing is, don't worry about memorizing all the details.
Okay.
We're used to doing the talking, but we do need help of vaccine activists
Okay.
to schedule the meetings. We have to educate the staffers, and I curate every presentation based on the politicians' committee memberships. Because there's so much that I'm discussing, I don't say the same thing to each staffer. I'm only going to tell them about what they can do something about because they're on energy and commerce or
Okay.
natural resources or the health committee or judiciary.
That's very helpful. So when people reach out to you said Congress members, senators, and representatives, and a lot of times they're asked who will be in attendance, or they can just freely say Charles Frohman and the name of your attorney.
Well,
think-
maybe, but we've gotten away with what we coach you to say is, I'll give you a link so you can find out who your rep is. Most people don't know who the rep is. And then there's a generic phone number to call the operator to get to the politician. Once there, you just ask for the name of the telecom staffer, and then the email address, ask for that, and then email them a request to Zoom over the next couple of weeks to discuss telecom bills to bridge the broadband digital divide. That's the stupid phrase that telecom uses to bully their way through all these bills.
Yeah.
And the telecom staffers don't know anything. And that's why we have to educate them. And you're going to be frustrated, but take yourself back a decade to the state legislatures. How much did these health staffers in your state capitals know about vaccines? Nothing.
Right,
How much did you know? Nothing.
That's
It
true.
takes forever. It takes forever to learn this stuff, and that's okay. But usually you can get a meeting scheduled. We have a availability schedule. Give it to the staffer, picks a time, Zoom is scheduled. All the constituent needs to do is talk about, what to think about, property values, just simple stuff. So we try to make it as easy as possible.
Okay, so
You don't have to know anything about the issue.
that's really, really helpful and puts a lot of us at ease, which I'm sure was your whole intent. And so it seems that usually when you ask for a meeting, they'll ask who's going to be there.
Yeah, so you give them a list. You invite your friends from the state to join you.
Okay.
They usually don't have a problem. They're a half hour long, these meetings, Zoom. It's Zoom.
Okay.
In Washington, you have a couple of bigwigs, Professor Martin Ball or something. There's some professors around the world that are top notch, and I think you have one of them because we met with
Is that
McMorris.
Martin Paul at Wazoo?
Paul.
Yes.
And
He's
Sidney
willing to
Frank.
jump on?
Yeah. He's been
my
on
gosh,
before.
that's amazing. Okay.
Yeah, and McMorris Rogers from Spokane was the top Republican on the Energy and Commerce Committee. She was horrible on this issue, like most Republicans. Look, all Republicans have cared about is deregulation, helping industry, and like most people, they just want faster downloads. They don't want any dropped calls. It was only because they were so great on vaccines and they love RFK that they're open-minded to hear this message. But it's not easy for them because they're getting a lot of money from telecom to allow tower deployment wherever telecom wants it. So next door to you, on my Freedom Hub show next week, I'm having this colonic health guy, David DeHaas, who has his own podcast, who's close to a congressman on that same committee. And a builder was injured because he was between three towers that beamed right through his house and gave him a brain injury. And this free market conservative has been terrible on telecom, but now he's finally listening. So it can be done because, conservatives really were shocked through the pandemic, right? They became really heroic fighting that vaccine mandate, and they're still doing it with Ron Johnson, Rand Paul, a bunch of House Freedom Caucus members. So they've got to see the similar threat from wireless. There's no informed consent, there's suppression of the science, and there's utter capture of the regulatory process. RFK is leading this issue. Republican conservative, stop putting your head in the sand and listen up. This is a good issue for us. And indirectly, folks are learning about it also from the data centers. Oh,
yes.
Because there is a wireless radiation threat from it. It's not as much talked about as the utility, the usage of water and energy and electricity prices, or the hit on home values from having this monstrosity located near your neighborhood. But that's indirectly helping us because it's also the data centers are suspicious.
Yeah.
People are wondering why so many, why so big, why the rush? Is it to is it to
Right.
collect all the data on us from the monetization of data from all the Internet of Things? What's it for? So that's helping the wireless issue because people really are focused on data centers. They're focused also on the phones in schools. A lot of governors are banning phones from schools because of woke content or the effect of excessive phone usage on mental health and just the distraction of all these phones in the schools. And RFK Kennedy also includes the wireless radiation health risk for as one of the reasons to ban the cell phones. So that issue is helping us indirectly because
Okay.
most people banning cell phones in schools aren't doing it because of the wireless radiation risk.
Right.
They're doing it for the other reasons. People are concerned about data centers not because of the wireless radiation risk, but being focused on those other adjacent issues indirectly, I think, will help us.
Helps bring us. Yeah. Unfortunately, most of these kids have a laptop of their own in the schools, and all those same things that you just mentioned are all happening with and on those computers. But tell me, this is the first time I've heard mention of wireless risks from these AI centers. Can you tell us a little more about that?
I can't really.
Okay.
I mean, it's sort of a new issue,
Yeah.
but I've seen some evidence, and I'm sure we'll learn more. But if folks take up the invitation to join our semi-monthly Zooms with the National Call for Safe Technology, you will learn more about that and everything else. There's so much more. I mean, there's the Havana syndrome, the use of
Yes.
wireless weaponry on victims, whistleblowers and dissidents. It's horrible what's happening to good people who blow the whistle on truth in America. There's a very nefarious, seedy side to this issue. I mentioned a bit about it with the social credit score and the behavior manipulation that will come from the wireless mesh.
Yeah. So chilling. Okay, we have about 5 minutes left. What can ordinary citizens do before a tower is proposed, or while one is pending, or when legislation and rulemaking are moving quietly at the state or federal level, besides what you already mentioned of coming and talking to their members of Congress?
Well, that's where Children's Health Defense comes in. They have a nice program with Vanessa Shimoto and Scott McCullough. Unfortunately, it's usually after the fact, like in your state, where these nice property owners are desperately trying to defeat a cell tower that already has been approved.
Do they have to give notice when a cell tower is about to be deployed on or near their property, or how do people usually find out?
They usually just see the tower, but there is a notice requirement, and how the government locally implements the notice can be lame at times. What we find out after the fact also is that people have not pressured their local politicians to update the ordinances for telecommunications equipment. So it's already pretty weak in the first place. So to answer your question, to make sure these ordinances have setbacks, setting back the antenna a football field or a mile in distance away from your neighborhoods or your kids' schools or your nearby parks. So Vanessa is CHD can help you get that effort underway with a local ordinance effort. That's what you need to do beforehand. But we know people usually act after they've been audited or in trouble. So if you do face a cell tower near your kid's school, your neighborhood, or your nearby park, contact Vanessa, because you'll need the lawyer help of Scott McCullough ASAP to come up with a creative defense, because your defensive options are limited because of all these preemption provisions in the law that telecom snuck in with their buddies in Congress while the rest of us were asleep for decades.
Yeah.
So
Well, What's
We
Vanessa's
need the
last?
federal help too, and the state help.
What's Vanessa's last name at CHD?
Shinmoto, but you probably can. I can get you her full name after the fact. I don't have it handy,
Okay.
but if you go to CHD's website and just follow wireless, you'll get to at least Miriam Eckenfels. I think that she's the lady in charge there, and she can direct you to proper people. And then you can join my National Health Federation monthly Zoom too. Every third Friday at noon Eastern, we have all the MAHA issues, including wireless. I just had a nice farm panel on pesticides and wireless. This coming month, I have the vaccine issue.
Okay, what's that website, Charles?
TheNHF.com.
And then where do they go to find your call?
Under Join Us, sign up for the E-list.
Okay, very good.
I'll put that in chat so you can just copy and paste it. Doo-doo-doo. There you go.
Thank you.
So I recommend that because to me, all the health issues synergize.
Yes.
I'm trying to create catch patients, which we haven't discussed. I consider that
Have you back
critical.
on to talk about that?
We have to have people caring what's happening in the health market. And when you're a catch patient, you do. You have to care about vaccines so you can care about wireless, so you can care about geoengineering and fluoride and pesticides and GMOs and all the issues. They're all important.
I know, yeah, and there's so many, like you said, people. Well, some of us have been asleep more than others, or people are just trying to live their lives, and there are just so many battles on our hands.
But polls show people care. They're willing to pay more for higher quality. There's even a poll showing they care about vaccines despite Trump shutting RFK up. So the polls are still with us, vaccine friends. And the polls are with us on wireless. Most people want a wired connection, not wireless. And they're telling realtors they don't want a home near a cell tower. So we have good Americans on our side. Get involved.
Yes. Okay, Charles, it's been great having you on, and thank you so much. Tell people your Substack, please.
Yeah, that's the best place to reach me. At least once a week, I'm writing at Substack. My full name with the initial, Charles D as in David Frohman, Frohman .substack.com. CharlesDFrohman.substack.com. And if you're around 2 weeks in Virginia, Joel Salatin's farm has a great event, 2 Days of Truth. I'll be speaking there. And in DC in July, please come to the Patient First Coalition event where we marry activists with entrepreneurs, making money doing good.
Amazing. Well, that Joel Salatin thing is going to be phenomenal. Hey, we really got to have you back on to talk about some of this healthcare market stuff, because we touched on that at the NHF conference in Dallas last month, and it was really exciting. There's a lot of good solutions out there. So thank you again, Charles. Really great having you on. And join us next week, ladies and gentlemen, for Juice Lady Sherry Colbum, who will discuss her new book, The Truth About Seed Oils. And I'd like to thank our KKNW producer, Nathan Miller, for all his work behind the scenes, ensuring a clear, professional broadcast. And thank you, ladies and gentlemen, for tuning in to Informed Life Radio on 1150 AM KKNW and CHD TV. This is your host, Lisa Templeton, signing off for the week. Here's to embracing your informed life. Have a good weekend, everybody.
Informed Choice Washington is a nonprofit organization that advocates for healthy immunity, medical freedom, and fully informed medical consent. The right to make medical choices without coercion is fundamental to our civil liberties and a basic principle in all human rights declarations. To learn more, tune in each Friday from 4 to 5 p.m. to an Informed Life Radio and visit the website informedchoicewa.org. It's time to take a stand for medical freedom. Go to informedchoicewa.org today.
Did you know that solutions containing iodine can inactivate viruses in the nose and throat in 15 seconds? And hydrogen peroxide can do it in under 30 seconds. Decades of studies, including many conducted during COVID, have shown that properly prepared and used nasal spray and gargling solutions can reduce your risk of infection, reduce viral load, reduce symptoms, and reduce transmission of viruses. To learn more, go to healthyimmunitynow.org and check out the EFU Challenge. Why spread fear and infection when nature provides solutions? Go to healthyimmunitynow.org today.
The information contained in this episode is for informational purposes only. No material is intended to be a substitute for professional medical advice, diagnosis, or treatment.